Welcome to bone formation and structure. The process of bone formation and repair is called osteofication or osteogenesis. There are two key factors that start this process, called osteoinduction, along with the guidance of osteoconduction. So let's dive into osteoinduction, which involves the stimulation of cells. The main osteoinductive agent is bone morphogenic proteins. These proteins are what stimulate the mesenchymal stem cells, which then can differentiate into osteoprogenitor cells that turn directly into the osteoblast cells. Osteoblast cells are the main bone-building cells, but we'll get into those in a bit. Let's talk about osteoconduction now. So osteoconduction has really no involvement in making of the bone, but it rather provides a scaffold or framework for cells to attach to. This scaffold allows for blood flow and cells to migrate through and embed into its structure. Okay, so what are osteoblasts anyways? The bone is constantly remodeling, like shedding of old bone replaced with new bone. Like I mentioned before, osteoblast cells have direct involvement in bone formation. They secrete an organic bone matrix called osteoid. Osteoblasts are responsible for mineralization of the bone matrix. Now, these osteoblasts have to mature at one point into osteocytes. Osteocytes are responsible for maintaining the bone matrix. The osteocyte cells further mature into osteoclast cells. These are multinucleated cells that resorb bone tissue. Okay, so let's recap a bit. In osteoinduction, bone morphogenic proteins stimulate mesenchymal stem cells, which then differentiate into osteoprogenitor cells, and then turn directly into osteoblast cells. The osteoconduction provides a scaffold for cells to attach to. Now the process of osteogenesis takes place. Since the scaffold is loaded with the osteoblast, it can now repair the defected area. Now that we talked about how the bone is formed, let's move on to the actual structure of the bone. There are two different structures to the bone, cortical and cancellous. First, let's look at the cortical portion. Cortical, also known as compact bone, is the dense, stronger outer layer of the bone that provides structural support and protection. Cortical bone makes up approximately 80% of the total mass of the human body. It provides rigidity and shape to bones. It resists compressive and tensile forces. It provides protection against vital organs. So the cancellous portion of the bone, also known as spongy bone or trabecular bone. Cancellous bone is categorized as a lattice-like structure. Cancellous bone distributes mechanical forces and reduces stress on joints. It has a rapid turnover rate supporting fractured healing and grafting. Its high red blood marrow count supports hematopoietic. It also helps regulate calcium and phosphate. Both cortical and cancellous play a big role in dental grafting procedures. Cortical bone can provide strength and stability, although it does remodel slower than cancellous due to its dense structure. Cortical bone acts mainly as a scaffold for new bone growth. Due to the porous structure of cancellous bone, it's easy for migration of osteoblasts and blood vessels, promoting healing and integration with the host bone. It remodels quicker, which leads to faster healing. It also contains bone morphogenic proteins that stimulate new bone formation. A combination of cortical and cancellous bone is often used in bone grafting to provide structural support and fast healing, making it an excellent choice for dental implants. Now, when we're talking about bone grafting, the next question we have to ask is mineralized bone or demineralized bone? What's the difference and which one's better? Both are used in bone grafting, but differ in composition, biological activity, and clinical application. In demineralized bone, the inorganic material content is removed during an acid process, leaving behind organic material. Since mineralized bone doesn't go through an acid process, it retains its organic mineral content, which provides strength. Alright, so let's compare the two. The mineral content for mineralized bone is retained since it doesn't go through an acid process. And for demineralized bone, it's removed since it goes through the acid process. Mineralized bone is not osteoinductive. Demineralized bone is highly osteoinductive, since only the organic matrix content is left, leaving it high in growth factors. Both mineralized and demineralized bone are osteoconductive, providing a scaffold system. The resorption rate in mineralized bone is slower than that in demineralized bone. The structural support for mineralized bone is high, leaving it rigid and strong. The structural support for demineralized bone is low, leaving it soft and flexible. Your best use case for mineralized bone is structural support and ridge preservation. And it's best to use demineralized bone to promote healing in poor bone quality areas. So, if you want fast healing, choose a DBM. To maintain structure and volume, use mineralized, or combine both for enhanced bone regeneration. Thanks for watching Bone Formation and Structure.